Hello.
Hi, my name's Amanda. I'm a level 1 nursing student. I was assigned to shadow you today.
Okay.
Do you mind giving me a report?
Oh, yeah. And then my name is Jessica. I'm going to be the nurse of Ronald Jarvis, and he's 67 years old. And he was first admitted for complaints of high blood glucose, and then also a non-healing wound on his right heel. He had noticed it about 3 weeks ago, and it hasn't healed since then. And his he said his blood glucose was consistent to in the 120s, but we just took it a little bit ago, and it was 242, which is pretty high. So he's going to get about 12 units of Lantus today, and it's right before bedtime because Lantus is a long acting, and then he's fairly active, I guess. About once a week he goes bowling and drinks about a 16-ounce of beer, and but about his lesion on the right heel, first noticed it about 3 weeks ago, states that it's non-healing, that it has become increasingly painful. He tried soaking it in salt water at home, but that did not provide any relief. And so what we're going to do with the wound is clean it and irrigate it twice a day. And he's on an 1800 caloric diabetic and a 2-gram sodium diet. And his vital signs are pretty stable. He has multiple other medications, but like aspirin and morphine for pain if he needs it. And any other questions? That probably takes care.
Why are you specifically giving him the Lantus?
Well,
And what is the action of this medication?
Okay. Well, it's a long acting, so that's why we take it before bed. That's why we're going to give it to him before bedtime, so then it lasts through the night. In the action, it lowers the blood glucose because his was kind of high, and it stimulates the glucose uptake in the skeletal muscle and fat, and inhibits hepatic glucose production. And then other actions include inhibition of lipolysis and proteolysis and enhanced protein synthesis. Mm-hmm.
When should you question administering this medication?
Well, probably if his blood glucose was low, then we probably shouldn't want to get it because they would just lower it, and so hypoglycemia would obviously be the result of giving it to him.
Does this medication have a therapeutic serum level?
Yeah. So it would probably be around like the normal. It will probably bring it down to like the normal 70 to 120 level. Mm-hmm.
Which vital signs must be monitored?
Probably the glucose, obviously, and then so really just the glucose, and probably it's pretty good to like check all of them just to make sure he's not having a reaction to anything.
What interventions must be taught to the client to ensure this medication is administered safely at home and in the hospital setting?
Well, he wants to make sure that he probably eats something afterwards, just to make sure that that he doesn't go into a hypoglycemic state, and then I would want to teach him the signs and symptoms of hypoglycemia so he can watch out for any like symptoms of that, because that could be very deadly.
What are the side effects and potential adverse reactions?
Well, obviously the first one, the main one would be hypoglycemia, and then anaphylaxis. That's like a big one that is very dangerous and can be fatal. And urticaria, that's another one, and some itching, redness, swelling at the injection site.
How will you know if this medication is effective?
Well, we'll check his blood glucose, and if it's within normal therapeutic range, then we'll know it's effective.
Okay, that's all my questions for
Okay.
now.
Do you want to come meet the patient?
Sure.
Okay. Let's see. Knock, knock, knock. Hi, Mr. Davis.
Hello.
I have a nursing student here today. Her name is Amanda. Is that okay if she comes and watches?
Hi.
Okay. I'm just gonna wash my hands, and then I'm gonna check your name and or your age. And can you tell me your name and age?
Ronald Jarvis.
Okay.
I'm 67.
Okay, perfect. And then so today I have Lantus for you before you go to bed. It's a long-acting insulin. I'm sure you probably would take it at home. And so first I'm gonna scan your pouch. Do you have any allergies today?
No.
Okay. Perfect. Okay, let's see. Okay, let me scan one more time. Okay, perfect. And then, Amanda, what I always like to do, obviously, when you're administering medications, you do your, at least the 3 checks to make sure. So I already verified the patient, but I'm going to verify it again because I have it scanned in here. Mr. Jarvis, would you mind stating your name and your age again for me?
Ronald Jarvis. I'm 67.
Okay, perfect. And then I like to check, want to check the expiration date and then make sure, obviously that it's not expired, and then make sure that the dose and the name is comes up there and everything matches. So we got Lantus and the correct dose. And today his glucose was 242. So we have a scale that shows us that he's going to be getting 12 units of insulin. Okay, so I already did my 3 checks, and then I'm gonna scan that. And then, okay, so first we're gonna draw back the 12 units of air. Alright. So we got the 12 units of air. And then we're gonna alcohol swab this. We're gonna insert the 12 units of air and then cover that side down. 12 units of insulin. Making sure that there's no air bubbles. Okay, Mr. Jarvis, where would you like your insulin shot today?
In my abdomen's fine.
Okay. Let me go to then we're gonna
Right there in the belly.
and you're gonna looks very squishy. You won't even feel it. Okay. How did that feel? It's fine. Okay, good. Okay, and then and so we like to do in the abdomen because it's faster it absorbs the insulin faster, and he's a bowler, so we wouldn't want to put it in the arms because then it will even, we don't want to put it into the area that he uses the most. Like if he were to run, we wouldn't want to do it in the leg. So Mr. Jarvis, I read that you wanted some dietary information about for diabetics.
Yeah, because my sugar's been really high.
Yeah, I noticed that.
I went off my diet. It's hard.
Christmas time, yeah. That pie. So we like to, for diabetics, probably a minimum for carbs 130 grams per day. That's always a safe thing. And then make sure you include fruits, vegetables, grains, and low-fat milk. And then you can also do the carb counting. I don't know if you've heard of that. The fiber intake of 25 to 30 grams per day. And then for protein and fat, 15 to 20% of total calories should be for that. And then limit your saturated fat to less than 7% of total calories. It's hard to do, but just try. And then trans fat should be minimized pretty much at all. But there's really not a lot of foods these days that really have a lot of trans fat. Even like donuts, I saw in the Dunkin' Donuts, they say 0 trans fat. Okay. But
Give me some donuts.
Made for breakfast. So and then also like the cholesterol, keep it to under 200 milligrams per day, and then also try and have 2 servings of fish per week to have to provide that polyunsaturated fats, fatty acids, and then well, I've noticed that you drink it said 5 or 16 ounces of beer every time you walk. Yeah, so just like one night a week, which is good. So, because I heard you have 2 drinks per day, so I mean you're doing fantastic. And it should be consumed with food to reduce the risk of nocturnal hypoglycemia.
Okay.
Yeah. And then also just in addition to maybe your 1 day of bowling, if you can just do a few, maybe like 2 other days of exercise, because it's recommended to do 150 minutes.
I'll walk the dog more.
Okay, yeah. And then if Fluffy, wants to go a little faster, nice, brisk walk. Yeah.
Oh.
I mean, you might have to be carrying him at the end, but
I'll just
that was like
drag
a workout. Get a little back time. But so okay. Did you have any other questions?
No, I'm good, thanks.
Okay, you're welcome.
Is my call light here somewhere?
Yeah. So it's right here.
Okay.
Right here, and then there's also a button right there. But there's your call light. We'll put that there.
I'll call you if I need you.
And then I'll send the technician to do like your nightly care or whatnot. So if you don't have any other questions, then I'll go do some charting.
Thank you.
You're welcome. I'll be here all night for you. Okay. Thanks, Mr. Vernon. Okay. So, Mary, did you have any questions for me, or?
Yeah, I have a couple more.
Okay.
Were there any pieces of pertinent information that you reviewed before administering this medication?
Well, I just made sure that his blood glucose was at a certain, obviously the level. I would say if it was like under 120, I wouldn't have given it to him. And then I probably would just like maybe give him like a small snack or something like full of like carbs before he ate if it was within a therapeutic range.
Okay. Did this information affect how you administered this medication?
About of how I administer it? Well, obviously if it was low, then I wouldn't have given it to him. But I guess just where I did it, I did it in his abdomen because it's faster absorbing, and I know he uses his arms a lot when he bowls, so that's why I use the abdomen.
Okay, that's all my questions.
Okay, do you want to watch me chart?
Sure.
All right. Well, let's do this.